Well, hey there. How you doing? This is Byron Matthews with Smoky Mountain Group. Want to cover a plan today with you that I think you're really going to like. This is going to be a fit for some people, not for others. So after you watch this video, you'll be able to call us with some questions and we can definitely answer those and make sure that you've got the right plan for you. And here we go. So I'm going to screen share with you and bring up the details of the plan. I'm going to cover the benefits at a glance. You can still see me over here in the corner, but I'm going to walk through this with you and then cover the summary of benefits as I'm required to do. So first of all, the monthly plan premium you can see right there is zero. What does that mean? Well, you still have to pay Medicare. Medicare Part B comes out of your Social Security check. In 2022, it's $170.10 a month. We don't know yet what it'll be in 2023. If you're watching this in 2023, you already know what it is. But regardless, whatever it is, you still have to pay that unless you get assistance from the state or the federal government because of a limited income. You have to pay that to be a part of a Medicare Advantage plan because it's part of Medicare. All of this is part of Medicare. But with this particular plan, your monthly Plan B premium will be reduced by up to $100. We say up to because it's in different counties, but the counties, and I'm going to show you a list of them. If you're getting this video, if you're watching this video, it's because we gave it to you and you live in a county where this applies. It's a $100 rebate. So that $170 would only be $70. That's a $100 a month pay raise, $1,200 a year. This is a fantastic plan. We really think that you're going to love this plan. Now, if you have very limited amount of going to the doctor or hospital, definitely you want to consider this plan. If you see the doctors and hospitals a lot, there are other plans for you that have a little bit better copays. And so it's a trade-off. Everything is a trade-off. There's nothing for free, right? So you say, well, how's it zero premium? The government funds these programs, so they're not free. The government's paying for them and you pay taxes all your life. So this is a benefit you can enjoy when you're on Medicare. So let's get started. $350 combined deductible. This does not, however, apply to things like doctor office visits, specialist visits, lab work, and you can read through this whole list of things. The things where the $350 deductible applies would be like a hospitalization, an MRI, chemotherapy, dialysis, some of the bigger things, and we'll talk about that as we get down there. There is a maximum out of pocket of $8,300. That's the most you have to pay. Max out of pocket means the most you have to pay in a calendar year. $8,300. So that's a lot of money. Well, it's not like getting a $500,000 bill and trying to figure out how you're going to pay for it. Okay, so there is a cap of $8,300. It says in network $12,450 combined in and out of network. If you go out of the network, the good thing around here in the counties where we have this is it's hard to find a doctor who's not in this PPO network. It is a PPO, not an HMO. So you can go to virtually any doctor because you can go in or out of the network, but you want to try to stay in the network because it's going to be a better copay, but really you're going to have a hard time finding a doctor that is out of the network. So not something that you really need to worry about. So here we go. Primary care doctor, that's your family doctor, zero copay. Over here is Medicare only if you go out of the network. And here is if you get state cost protection, that would be if you get Medicaid. But we have a better plan for you if you get Medicaid, so reach out to us. This is the wrong video for you. So Medicare only in the network, $0 for a family doctor, $45 for a specialist. Not bad. You're probably used to paying copays. All right, so 0 for family, 45 for specialists. The $350 deductible, again, doesn't apply here. Medicare covered screenings. These are like cancer screenings, pap smear, mammogram, PSA, all these different screening tests. No cost for you, and the deductible again does not apply. If you go to telehealth, a lot of people since the coronavirus are using their phones to talk to their doctor on the phone. No copay for your primary doctor, $45 for specialists, 0 for urgent care, and 0 for substance abuse. Acute inpatient care, $450 copay for the first 4 days in the hospital. This is where the $350 deductible has come into play. So if you haven't met the deductible, which probably on the things you've just seen, the deductible doesn't apply. The deductible does apply here. So you got a $350 deductible. Then your first day in the hospital is $450. That would make it what, $800 for your first day in the hospital. Again, you're getting $1,200 back off of your Social Security. So that's probably not too big a concern for you to have a $350 deductible, because if you don't go to the hospital, the deductible doesn't apply here. Does that make sense? Again, it applies for the hospitalization, MRIs, chemotherapy, dialysis, some of those bigger things. But again, this plan has probably been directed to you. You're looking at this plan because you're generally pretty healthy. You're not thinking you're going to get an MRI anytime soon, or chemotherapy, or spend the night in the hospital. So if you go past 4 days in the hospital, you pay nothing. You stay a week, 2 weeks, 3 weeks, up to 90 days in the hospital, you pay zero after the first 4 days. Sounds good? And that, by the way, that deductible of $350, it's only once a year. So when you factor in your $1,200 rebate, you've got that covered almost 4 times over. So not to worry. Lab tests are zero unless they come from a hospital. They would be 10. Outpatient surgery, $400 at an ambulatory surgical center. That would be like your doctor's office, like a cataract surgery. Physical therapy, 20. X-rays at the outpatient facility, 105. Diagnostic testing at an outpatient hospital, 95. Mental health, if you go to the psychiatric situation, $450 a day for days 1 through 4. Specialist for mental health is 40. An outpatient hospital, 95. Partial hospitalization, 40. That would be like group therapy. Then you go into emergency services like urgent care, $40 copay. Ambulance, $300 copay. That includes a helicopter. $300 if you were picked up by a helicopter for an emergency. Emergency room, $95 copay, which is also waived if you're admitted to the hospital. So routine dental services. The dental services, it covers up to $500 a year of dental care. And that's covering not just routine, but it also covers, and you'll see this in the summary benefits, comprehensive stuff. This is your crowns, your root canals, your cleanings, your x-rays, all those kinds of things, basically everything but cosmetic, $500 a year of dental. Now we have other plans that cover more dental, but they don't give you 100 back every month. Again, that's probably why you're looking at this, because you don't have some big dental needs on the forefront. If you do, maybe you want to look at another plan. Call us about it. Routine vision services, routine hearing services, silver sneakers. A lot of those vision and hearing we'll cover on the summer benefits a little bit more. Silver sneakers, that's your gym membership, 15,000 gyms around the country that you can go to. A special supplemental benefit. This is a special meal program. If you have COPD, diabetes, congestive heart failure, or depression, they can provide you with up to 2 meals a day for 12 weeks, 168 potential meals, because you can do it twice in a year if you have these conditions, to help you get your balanced diet. And this is food delivered to your home for free. Pretty cool. Humana Well Done, that program is included for everybody who either comes out of a hospitalization or a rehab stay, 10 frozen meals delivered to your door. Both of these people have told me they've gotten these meals, they taste good. A couple of people said they didn't. I really honestly believe it better when a couple of people told me they didn't like the food, because I had person after person after person tell me they like the food. So the majority like the food. Okay, prescription drug benefits. This plan does include prescription drug benefits. There is a deductible on tiers 3, 4, and 5. Notice that a deductible for tier 3, which is name brand, tier 4 is non-preferred name brand, and tier 5 is specialty. So for first 2 tiers, preferred, generic, and generic, there's no deductible. If you do mail order, they're free. And you can see, because this is red, they really like you to do mail order. Humana's mail order is called Centerwell Pharmacy. That's a new name for them this year, just changed this year. So mail order is kind of the way to go, especially on generics. You do save a little bit on the name brands if you do mail order. And of course, you can go to the store. Again, you're going to have all these documents. You're going to be able to see these numbers. And if you get an extra help program, that means you have a limited income. How do you know? Call Department of Social Services. I can't help you qualify for that, but I can direct you to Department of Social Services, because they can tell you on the phone, does your income qualify for that assistance? And there's a lot of people that don't realize they can get that assistance, but you should call and see if you can get help. And that will reduce significantly your cost of medicines. So call Department of Social Services, your local county DSS. So scrolling through here, that's the basic benefits at a glance. The summary of benefits. Let's come down here and show you the counties where we're working. Here's your counties from Alamance County all the way to Yancey County. So if you see your county in there, this is a plan that you want to consider. If you live in a county and it's not on here, then you're watching the wrong video. Call us and we'll get you a different video. So those are the service areas. Again, we got really good coverage with the PPO network for these doctors in these counties. And in all the years we've dealt with network plans, we've had very little problem with Humana and the networks because they're very strong in the Western Carolina area. So to be eligible, of course, you have to have A and B Medicare. That's why you pay the $170 Part B premium, but you get $100 back. Remember, you get $100 of that back because of the rebate on this plan. And then this is the same thing we talked about before. Zero premium, as we mentioned, $350 combined in and out of network deductible. Well, there's your $100 rebate on your Part B, excuse me, $350. But again, it doesn't account for primary care, specialist, lab work, ambulance, emergency room, urgent care, Medicare covered preventative service, diabetic monitoring supplies, chemotherapy, drugs, and administration. Now, chemotherapy is different, but so there'll be in your evidence of coverage, there'll be the list of every single thing that the deductible applies to. But really, the bigger things are things like your hospitalization, your MRIs, your chemotherapy, dialysis, those kind of things. So no deductible for generics, tier 1 and 2, $265 deductible for drugs on tier 3, 4, and 5. Max out of pocket $8,300 in the network. Again, a great network. Your hospital $450 a day for the first 4 days. Outpatient surgery $450 at a hospital, at an ambulatory surgical center $400. Oh, this is true too. This is really good right here. You do not need a referral to receive covered services from plan providers. In other words, you don't have to go to your family doctor to then go see a specialist with a referral. You can go straight to the specialist. As long as they're in the network, which we've always said, that's a really good network. Eye doctor, ear doctor, skin doctor, bone doctor, heart doctor, lung doctor, all those specialists that you want to go see, just go see them. You don't have to go get permission from your family doctor. That's a great benefit to this PPO plan. Okay. Primary care, again, zero, specialist 45. This is the same thing we saw in the benefit at a glance. The preventive care, this just lists out all the detailed things that are covered under preventive care for zero copay, no deductible. Emergency room, 95, urgent care, 40, outpatient diagnostic care and lab and imaging. When it says 45 to 75, let's just say 75. And if it comes in at 75, great. If it comes in at 45, thank the Lord. Okay, that's probably going to be on this higher side. $75, $180 for diagnostic radiology, lab work $40. The difference here is if you go to Quest Diagnostics for lab work or LabCorp, freestanding lab, versus getting it from the hospital. So you probably want to go to Quest. Just ask your doctor for a lab work prescription, go to Quest, get your blood drawn, get your lab work done. So you can see x-rays, radiation therapy, Medicare covered hearing visits, $45. Here's your hearing aid stuff. I told you about hearing aid. $599 copay for each advanced level hearing aid, up to one per ear per year. $595 copay for hearing aid per ear. $899 for a premium level hearing aid, one per year per ear. Okay, so you can get for less than $2,000 premium level hearing aids. Now, it may not cover everything you wanted to cover. It may not be the Cadillac, but you should call True Hearing at this toll-free number. They can come to your house, do the hearing test, come to your house, deliver the hearing aids and fit them, teach you how to use them. I have a customer that did that last year. She got her hearing aids for less, $4,000 hearing aids for about half off. Okay, that's what we're looking at. She got the premium level hearing aids. So this is a pretty good deal for hearing aids. Not everything you see on TV, sometimes that's smoke and mirrors, so be careful. This is legit stuff through True Hearing. Medicare covered dental. Of course, we know Medicare doesn't really cover very many, if anything, dental. So really you want to look at this, the $500 that I said earlier for, what's that say right here? Comprehensive preventative and comprehensive dental services. So those are your root canals, your crowns, your routine cleanings, your x-rays, extractions, major dental things like periodontal scaling and crowns. Those things are covered with no waiting period too, by the way, $500 a year. Okay. Yes, we've got plans that have more per year, but they don't give you the $100 back. So everything's a trade-off, guys. You got to find out if this plan's for you. We're just covering the basics here. Okay, no cosmetic. See that? No cosmetic. The allowance cannot be used on cosmetic services and implants, so can't do that. All right, vision services, $45 copay for vision exam unless you're diabetic or have glaucoma, and zero copay for post-cataract glasses zero copay for those. Now, it's not going to give you every pair of glasses in the shop. It's going to be a limited amount of stuff that you can choose from, but you can use that discounted price towards maybe a nicer pair of frames if that's what you want. And we're getting into, again, routine vision. There's $100 for glasses or contacts every year that you can get. So $100 off glasses or contacts. Inpatient mental health services, $450, zero copay after the 4th day. Outpatient group and individual therapy visits. Then you got skilled nursing. Watch this, zero copay for days 1 through 20. That's just like Medicare. Then $196 copay for days 21 through 63. Now in Medicare, it's days 21 through 100. You pay $196 every day. After 63 days, days 64 to 100, you pay zero on this plan. How about that? So the other thing about this plan is it does have that $8,300 max out of pocket. And you say, that's a lot of money. But guess what Medicare's max out of pocket is? They don't have one. So if you paid $196 a day for all days 21 through 100 on Medicare alone without your Humana plan, if only you had Medicare, that's over $15,000. And if you went home and came back, like my granny actually did, she had to do that twice. Now, she had other insurance that covered it, but if she only had Medicare alone, see, with this, you do have that max out of pocket that protects you. So that's how skilled nursing works. That's rehab stay. That's not long-term stay. That's rehab stay, skilled nursing. All right, then you've got physical therapy, $20 to $40, ambulance, $300. We talked about that, including helicopter. Medicare Part B chemotherapy, drugs, 20%, and other Part B drugs. Part B drugs are different than Part D drugs. Part B drugs are administered in the doctor's office. That may be like infusion therapy. That's what that's considering there. So then your prescription drug, again, $265 deductibles on tiers 3, 4, and 5. You reach your initial coverage gap at $4,660. Then you get into what's called the donut hole. If you want more questions answered about that, just call us about the donut hole. Then you have your copays, 10, 20 for generics, 47 for name brands. But if you go mail order, 90-day supply for zero on the generics and a little bit of savings on the name brands as well. So then you've got your, oh, look at this, insulin savings. Insulin, $35, 90-day supply, $105, which is basically 3 times 35, all year long. For insulin products, okay, you can call us or call Humana to see if your type of insulin is listed here, but $35, no deductible, no donut hole, no coverage gap, $35 a month all year long for insulin. This is one of those insulin savings programs that's on this plan. Not all Medicare Advantage plans have that. If you take any kind of insulin, you need to make sure that yours fits in this category, and we can kind of help you with that as well. So, and then if you get extra help, if you call DSS, you can find out if you get extra help, you pay lower copays on all of these things, including the insulin. So coverage gap, that talks about how the coverage gap ends at $7,400. Additional benefits, Medicare covered foot care, $45, chiropractic visits, $20, durable medical equipment, 14%, like that's like wheelchairs and oxygens, medical supplies, all that's 14%. Diabetic monitoring supplies, test strips, lancets, no cost when you use Humana's provided service for diabetic monitoring supplies. It's zero copay for that. Rehab, $20 to $40, cardiac rehab, 20, pulmonary rehab. Telehealth services, again, if you use your phone to talk to the doctor or go to urgent care on your phone, if you will. Or benefits, travel plans. You have Humana across the country. The PPO network is vast with Humana across the country. So when you go see your sister out of state, chances are you're going to find a PPO doctor there. But if it's an emergency or urgent care situation, you have to be treated as in-network no matter who you see. Nationwide, that's a fact for all Medicare Advantage plans. There's the Well Done, that's the 10 meals after the hospital. Go 365, that's a program that if you use Silver Sneakers, if you get your flu shot, if you get your routine physical, if you do those routine things that people need to do, then you get accumulate points, and they translate to discounts that come on cards like a Walmart discount card or a gasoline discount card. So you have to use those by the end of the calendar year. So make sure you check with Go 365. You call the number on the back of the card, they'll tell you what your points are. Silver Sneakers, that's 15,000 gyms around the country. And then that worry-free meals that we talked about earlier for folks who have COPD, congestive heart failure, diabetes, or depression, 2 meals a day for 12 weeks. That's 168 total meals, because you can do it up to twice a year. And there's no cost for this to participate. You do have to have authorization. So call the number on the back of the Humana card and say, hey, I've got diabetes or depression or COPD or congestive heart failure, and see if you can get some of those meals for free, help you get your diet balanced and in order. You can add additional dental coverage for $43 a month. That creates the 500 goes to 2,000. If you want to do something like that, call us, because we have some different options than that. So you can give us a call about that. This is the Humana website here, and I got to scroll through all this. Optional supplemental benefits. You can see that $43, it makes the dental benefit $2,000 per calendar year. So again, we talked about that. And scroll through here, there's a page of notes, and then we get down to the foreign language stuff, because if you speak in these foreign languages, there you go. We got to show you all these things, because that's the government's rule for us, guys. So, all right. So hopefully that makes sense to you guys. That answers a lot of questions, probably creates some questions, but give us a call. We'll see what we can do to help you. If this is the plan you picked out, or if you're thinking about this plan, we'd love to serve your needs as your Medicare insurance agent and your local agent to help you. And we appreciate your time, your trust, your loyalty, and your business. Keep in touch, guys. Bye-bye.